Officials and advocates are renewing calls to the city to increase its resources and services and outreach for those who are battling serious mental illness, with some adding, however, that more police will not remedy this crisis. Our Emily Note joins us with that part of the story. Good evening, Emily.
Good evening, Errol. Mental, emotional, and psychological well-being have necessarily been in sharper focus as this COVID pandemic wears on. But in light of recent violence among the homeless population, the question now is, are we doing enough for those who are in the most crisis but have the least access? The subway stabbings that left 2 dead and 2 others wounded this weekend have echoes of the October 2019 rampage in Chinatown, where 4 people were bludgeoned to death. Now, as then, both the victims and the alleged attackers were experiencing homelessness and mental health crises.
This is what happens when we fall down as a society and we don't take care of the basic housing and healthcare needs of everyone.
Police say the alleged assailant, who stabbed 4 homeless people on the A train line on Friday and Saturday, had 4 past arrests and was previously hospitalized for mental illness. Suspect Rigoberto Lopez was listed as last living in a Borum Hill shelter.
New York City, we lack a housing first model. And what that means is that people who are homeless and living with a serious mental illness actually have to jump through an incredible number of hoops to gain access to housing with support services.
The city's flagship mental health initiative has been criticized for its lack of transparency and failure to target serious mental illness. Thrive NYC is dedicating more funding to its crisis prevention and response task force in upcoming years. In the wake of the subway attacks, MTA brass repeated their call for more police and mental health resources.
By my count, myself and the chairman have asked the city for additional policing and mental health assistance in the subway system more than 30 times in the last 18 months.
Elected officials who attended a vigil for the subway stabbing victims also warned of a state of crisis.
I tell you, this mental health issue, it's about to explode on us. And very often, there's opioids or addiction involved in it. So they need help. We're not going to be able to jail ourselves out of this problem.
Advocates for the homeless maintain an influx of police is not the answer.
I mean, if we think about the tools that police have, it's necessarily going to be tools within the criminal justice system.
This is about deploying trained mental health workers and outreach workers, the combination of both.
Now, the stabbing suspect, Rigoberto Lopez, did undergo a psych evaluation after he was arrested this weekend, but his family tells reporters that he actually has no history of violence. Errol?
So the multiple arrests that he had, Emily, they were for offenses that did not involve physical violence?
Yeah, not to my knowledge. That record is something the police are still putting out, as they keep stressing that they're still investigating. But certainly when it comes to mental health resources on the part of the city, the criticism, especially when it comes to Thrive NYC, is a lot of the focus is on early intervention and not on those who might be in the later stages of crisis.
Right, right. I mean, the problem with that, of course, Emily, is that that sort of assumes that there's some sliding scale, and that a person can exhibit signs and just go down a path to mental distress, when in many ways it's actually a little bit more abrupt than that, right? You stop taking your meds and you go from here to there. There's no like warning signs along the way.
Well, there's many complicated factors, and of course each case is different, but that model also assumes that people will reach out for help or know that they need help, and really people might not have the support structure or the family who would nudge them in the right direction.
Right. Thanks very much, Emily.